There's an old expression: everybody has a disability now or gets one later in life. More than 2.5 million Ontarians live with some kind of disability. A lot of them are seniors, of course, one of the most vulnerable groups when it comes to contracting COVID-19. How has Ontario's response been at ensuring that the disabled are protected from the disease as much as possible, physically distancing with dignity, etc.? Well, let's ask. David Lepofsky, chair of the AODA Alliance, that is the Association for Ontarians with Disabilities Act. He's also a visiting professor at the Osgoode Hall Law School, and he joins us at his home in Midtown Toronto. And Wendy Porch is here. She is executive director of the Centre for Independent Living in Toronto, and she's at her home in the Dufferin Grove neighborhood of Toronto. And it's great to welcome you both to TVO. David, we've seen you on this channel many times, and Wendy, I think for the first time here. So great to have you along as well. Wendy, maybe I could start you off. We're going to do a deep dive in a couple of areas, but generally speaking, in terms of an overview, how well do you think Ontario's done so far at protecting the disabled during this COVID crisis?
Well, there are a number of things that we do know, Steve, and we know that people with disabilities are definitely more vulnerable to dire outcomes from exposure to COVID. So the deaths that we've been seeing in long-term care homes and nursing homes across the province, across the country, those are largely people with disabilities who are dying in those homes. We know that people with compromised immune systems are more likely to be impacted in a serious way by this illness. People with a range of disabilities have compromised immune systems, so we know that we're at risk there. And we know that people who are living in poverty are especially hard hit by COVID-19. People with disabilities live at or below the poverty line for the most part. So we have kind of a perfect storm of vulnerability happening. At the same time, we have not seen the needs of people with disabilities addressed in planning the response to this pandemic. So we are more vulnerable, but we are left out of the planning documents and the planning guidance. An example of this that I can give you relates to a program that my agency currently runs. So we receive funding from the provincial government to support people with disabilities in hiring their own personal support workers in order for them to be able to live independently at home. These support workers come in daily and help them to eat, to bathe, to use the bathroom. And so you can't do that job and not touch someone. The 1,000 people on our program across the province who are engaged in this program are having to buy their own personal protective equipment. So those are gloves and masks on Amazon, because there has been no effective plan rolled out to assist us in purchasing that PPE and distributing it to them across the province. So that is a risk for sure. As well, people with disabilities are at risk in terms of testing. Just, at the start of the pandemic.
Hold off on that, actually. I'm going to come back to testing in a second here. I just want the overview for the moment. David, let me just also parenthetically say, for those who don't know you, and I can't imagine there's anybody watching us who doesn't, because your contribution to this issue has been profoundly important for decades. We should say you're visually impaired, and I would like you to answer that same question about overview, with a particular emphasis on how those who are dealing with visual impairment are managing through COVID-19 as well.
Well, it's the same issue facing people with disabilities across the board. As Wendy explained, we're disproportionately likely to get the disease for medical reasons, any number of people with disabilities, and to suffer its biggest hardships. But also, because the government has failed to effectively include our needs in its emergency plans, we're even more disproportionately prone to get the disease. So whether it's vision loss or other needs, they're affected. If we get to talk about education, just as one example, the government has not ensured that its online resources for students learning at home are accessible to teachers or students or parents with vision loss. So
tell me what you mean by that. What's missing?
Well, for example, when you post content online, there are steps that can be taken to ensure that it's accessible. That's been known for people who do this work for years, and it's been the law for years. And yet the government, both the government's online resources and the resources they point teachers and parents to use are not designed to ensure accessibility. Some are, but unfortunately a bunch of them aren't, which means students with vision loss, teachers with vision loss, parents with vision loss are left out. Just one one example, but we could replicate or give you tons of other examples of, and that just means the burden of this COVID crisis is disproportionately falling on people with disabilities of all ages.
Since you mentioned this, David, I guess these are two words that probably ought never to be said in the same sentence, but journalistic integrity obliges me to say, in the interest of full disclosure, that of course TVO, one arm of TVO, is a partner with the Ontario government in providing the online learning that is happening right now in the province of Ontario. And I'm happy to give you a bit of a platform here to tell us whether you think, well, how well it's working or not. What are you hearing?
Well, we've pointed out both to the government and to TVO that there are serious problems with the accessibility of a number of TVO's online learning resources for kids from kindergarten to grade 12. And the Minister of Education, Doug Ford's Minister of Education, has said over and over again, we're providing online resources and our partner is TVO, and yet a quick look at some of those resources reveals that if you're using a screen reader like I do as a visually impaired person, it's a bunch of them are quite hard to use or not usable at all. And this is not something that was invented at the time of COVID. These are resources that predated COVID, and requirements of accessible web content have been around for years and have been the law for years. So it's a serious gap, and it's a gap that again points to the government's failure to do effective planning because before the government points to any resource and says, hey, here's what we're going to make available to hundreds of thousands of students with disabilities as well as all students, they should be making sure that content is accessible.
Okay, happy to give you a chance to put that on the record. Wendy, you wanted to talk about testing, and before I get you to answer a question about testing, let me read something from an Ontario NDP press release from John Mossa, who's a Toronto social justice advocate for people with disabilities. He works at CILT, your organization, and he said there should be COVID testing in the home of people with disabilities, especially if they are symptomatic, to prevent community spread and properly treat their illness. It is an accessibility accommodation the government should provide to vulnerable Ontarians, which raises the question of how easy or hard is it right now for those in the disability community to get a test if they need a test?
It's very difficult for people in the disability community to get a test if they need a test. So early on in the pandemic, we were told for people living in the community who needed to take paratransit to an assessment center that they could do that, but there was no guarantee that they would be riding in that vehicle alone. So they would be riding in very close proximity with somebody else who perhaps had COVID or suspected COVID. Whether you had it going into the ride, you might have it coming out of the ride at the other end. So that didn't make very much sense to us. In terms of mobile testing, certainly there has been an expansion of mobile testing, and we're seeing long-term care facilities having all of the residents and all of the staff tested. But supportive housing is still not largely being tested in the same way. So this is where people with disabilities live in accessible apartments and receive the same kinds of personal supports that I was describing earlier through an agency. Those agencies have only recently had a few of them have testing for residents and for staff. And so what we see is a perfect storm. We see that we are vulnerable. We see that we haven't been factored into the plans, and now you can't even get tested. So it is very, very hard for people with disabilities in the community to be tested.
We want to be crystal clear on this and want to do a follow-up on this question, Wendy, because the Ministry of Health has said, and I quote, "We can take the testing to them, especially people with disabilities." Are they doing home tests?
I understand, and not through any official capacity, this is through talking to people with disabilities, that in some jurisdictions, you could be tested through emergency medical services. But that is not across the board, and it has not been given out as any kind of complete guidance to people. And certainly for people that I know in the community in Toronto, there are no options, as I understand it, for mobile testing at the moment.
Okay. I want to talk about something that we touched on, I think, about a week and a half ago on this program, and it's just hugely controversial. And I know after we had the conversation on the program about it, David, you were kind enough to send me an email right away saying, "We appreciate you mentioning this, but this needs a lot more attention." So we're going to do that now. Some weeks back, there was a leak of a government document which attempted to figure out what are called triage protocols, which means basically if you got two patients and they both need a ventilator, who gets it? And these are really hard ethical calls for people in the healthcare world to do. But we have finite resources, and we got to figure out how, when there's too much demand for finite resources, we allocate all of those resources. David, what's your concern about what you learned about the triage protocols?
Well, these from other countries that have been hit hard with COVID, we know that the possibility could arise where there are more people who need a ventilator than there are ventilators. Now, thankfully, we haven't hit that situation. We pray we don't hit that situation here, but you need to plan in case you do. Well, the government had a March 28th protocol in circulation in the medical community, which gave criteria for frontline doctors to decide how these decisions would be made. And there were, when these were leaked to the disability community, huge concerns were expressed that they include discrimination against some patients because of their disability. In other words, their disability could be used directly or indirectly as a criterion to deprioritize them. That's a polite way of saying they might not get the ventilator. And as soon as this happened, over 200 community organizations released an open letter to the government raising grave concerns about this. Now, on your program back on the 14th of April, a doctor who was a lead participant in the writing of this suggested that the government's top priority was to consult on this. Well, that was only after this was leaked. And here we are over 3 weeks later, and we, among many of the organizations that have raised these concerns, have still not been consulted. Well, this is a crisis. The risk of a surge is still out there. We can't have the government continue to foot drag. Let me explain what this means for people with disabilities, because this is really serious. For one thing, it is critical that a doctor making a decision of who gets a ventilator, who doesn't, is not forming their judgment of what the quality of life would be for a patient with a disability versus someone without a disability, and then deciding on that basis who gets and who doesn't get. The second thing is that's really important is the danger to us is not just what actually happens in the ER, God forbid, should that situation arise, but the trickle-down triage effect, the fact that words out about this, Steve, could lead to either emergency medical technicians, EMTs, or nurses or others, or nursing home administrators thinking, oh, well, this patient may not be eligible for treatment, so maybe we shouldn't send them in at all to the hospital or send them down to the ICU or whatever it may be. Those kind of trickle-down effects are themselves scary. And the third trickle-down effect, which is that there are a number of people with disabilities who are afraid to even go to hospital, from what we keep hearing, for fear that they might get not only exposed to greater risk of COVID by just going there, but then facing greater risk of being deprioritized. The result of this is simply this. The government has said that so-called protocol is a draft. Well, then why? I worked for the government for over 30 years before I retired. When they want a document to be a draft, it says draft. Apparently, this one never did. But we need the government immediately to categorically rescind this document, to tell doctors and hospitals, do not use it. The second thing we need the government to do is to correct the confusion they've created by having this in circulation, by immediately launching and completing its consultation, including us and the docs at the same table at the same time. And finally, we need the government right now, if they've got a revised draft, put it out, let us all see it, let us all comment on it. Enough with the secrecy already. It's been weeks that this has been going on, and time is of the essence.
Wendy, what would you add to that in terms of what you want to see in the protocols that was not in the previously leaked document?
I think that David's completely correct that we need to be at the table when this kind of a protocol document is being developed, and it needs to be developed in a transparent fashion, and our voices need to be present. So as David was saying, the appearance of this protocol, the fact that this protocol exists, whether it's a draft or not, it has not been formally repealed by the government. It does exist out there in the world. And the fears in the community are that this is still going to guide people's decisions. So we have to have a place at the table.
Do you, I mean, I completely hear the argument that in theory, people from the disability world could receive inferior treatment as it relates to the allocation of resources in a COVID-19 crisis situation. In theory, do you have, though, Wendy, like specific examples that you can point to where in practice this has in fact happened in life or death circumstances?
Well, let me just jump in to help you. We have not hit the position where the protocol has had to be engaged, so we don't have that situation. We're hoping it doesn't. It only gets engaged if the overload of our emergency rooms reaches a certain point. So the idea of this document, Steve, is that it would become the rule should that happen. So we don't have any. It hasn't happened. It hasn't had to be used yet. So that's the first thing. And the second thing is the protocol, as analyzed by the Arch Disability Law Center and a couple of leading law professors who've released published an op-ed on CBC's website, have documented that it specifically identifies and deprioritizes certain disabilities by name. So this isn't theoretical that it embeds disability-based discrimination. And the way it operates, the formulae or the criteria it uses also have clear discriminatory impact on people with disabilities. And that's from experts in this area who've analyzed the actual document.
Can I add something?
Yeah, please, yes.
Yeah. So I wanted to add too that the existence of this triage document has meant that, and David was alluding to this, that people with disabilities are making choices to potentially not go to the hospital. So the knowing that when you get there and you might not actually receive life-saving treatment is going to impact people who are sick at home with disabilities about whether they even show up to the hospital. And compounding that further are the isolation guidelines in place around people with COVID in the hospital. Many people with disabilities rely on their support people and rely on others to communicate, and they can't have access to those people when they're in hospital for treatment with COVID. We've seen this in the news lately, and so people would be choosing to stay at home. I know many people with disabilities in the community who have said completely outright, I will not go to hospital if I get this because my chances are better at home.
That was the evidence I was looking for. Okay, now I think we understand that much better. David, try this on for size here. We know that, well, for example, Justin Trudeau has a member of the disability community in his cabinet. I don't know that there are any for the Ontario government. However, the government is getting a lot of advice. There's a central command table, there's a healthcare command table, there's a mental health table. You know, the list does go on. They're getting advice from a lot of different people. Is there anybody, to your knowledge, from the disability community that is a part of any of those advice-giving bodies?
Well, I could tell you who's been basically left out largely are those of us doing grassroots disability advocacy. Let me give you two examples. When the schools were all moved online, that created a real challenge for all teachers and all parents, a huge challenge, and for the government, and we cut them a lot of slack for that reasons. But they did not announce, and still not have announced, a comprehensive plan to ensure that the needs of over 1/3 students with disabilities would have their needs effectively met. The move to online teaching itself creates more barriers to an education system that was already full of disability barriers. So we reached out to the government and said, hey, you need to do the following. You can't leave it to every school board as they have to each reinvent the wheel, each teacher reinvent the wheel when they try to meet the needs of a student who is deaf or a student who has autism or a student who has an intellectual disability or learning disability. Why don't we gather from the front lines of teachers and parents what they've actually invented? Because people are coming up with some really creative solutions around the province and elsewhere. And let's share them with the front line. That's what the government's job is, but they haven't done it. So we stepped in, that is to say my coalition, the Ontario Autism Coalition, and this past Monday we held an hour-long virtual town hall organized totally by volunteers to offer expert advice from the front lines for some of the disability areas. Now we've pleaded with the government to take over this idea, use this model, gather up from the front lines what people are inventing and share them around. But they've not yet taken up that. We don't know if they've even shared with anyone with the school boards the link to our virtual town hall, which has already gotten hundreds of views within 3.5 days of us doing it.
I'm one of them. That was a good show.
Well, thank you. And we think that any parent or any teacher or any school board official work that may involve work with kids with disabilities should watch this and should let the government know we need more of this. And the government's got the resources; they could organize these things, and we've offered to help them do that. The second thing I'm going to tell you is that about a month ago, we did a first town hall, also available on YouTube, where we went through, Wendy was one of our 10 experts. We went through a wide range of different areas where the COVID crisis are affecting people with disabilities in healthcare, in education, in community living, in all sorts of areas. And we offered very practical tips, not pie in the sky stuff, but things that government could do as a top priority during the COVID crisis. Since then, we have not heard from the Premier's office. We've not heard from the Ministry of Health. We have not heard from the Cabinet Office. We've not heard from virtually any of the ministries with direct mandate over any of this. The only folks who've talked to us at all is the Ministry of Accessibility, but they don't have authority to make decisions over any of this. So
Well,
what
forgive me
we've
for
called
jumping in here, David, but we're plumb out of time, and I'm happy to be able to say that hopefully somebody from the government is watching this program tonight, and we'll hear both of you. David Lepofsky from the AODA Alliance and Wendy Porch from the Center for Independent Living in Toronto. Really good of you to spend some time with us on TVO tonight. Thank you.
Thank you.
Thanks so much.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.